Hi everyone, my name is Emily Bahrke, and I will be talking to you tonight about if elementary school social workers should implement routine screenings for parental alcohol abuse. So, we know that child abuse is an ongoing issue that needs immediate attention in our country. We need better preventative measures to be implemented and created to minimize the amount of child abuse cases. The U.S. Department of Health and Human Services Children's Bureau notes that Arizona had the greatest increase of child abuse rates from 2009 to 2012. We do not believe that current measures are showing to be effective. The current approach is ineffective, so the recommendation is for school social workers to begin routine screenings for parental alcohol abuse, since alcohol abuse is a major predictor of child abuse. Elementary school social workers will be able to utilize these screenings to prevent child abuse from occurring. This process will speed up and alert school social workers of immediate treatment that is needed. So, our conclusion is that screening for parental alcohol abuse can save lives. So, just to give you some perspective of what we're talking about here when we talk about child abuse, in 2011, the U.S. Department of Health and Human Services estimated that there were 677,000 abused or neglected children in the United States. So in 2011, there were 677, so more than 500,000 children in 2011 were abused or neglected. 18% of those cases were physical abuse. Another survey found that 49 out of 1,000 parents surveyed acknowledged committing severe physical assault on their children. And out of those 1,000 parents, 614 of them, so 61%, reported committing minor assault on their children. Unfortunately, not all children who suffer abuse live. As you can see on your screen, every year 850 children die due to child abuse. So when we're talking about child abuse, how do we define that? So broadly, child abuse is defined as a child who is physically, emotionally, or sexually abused. This should be distinct from neglect. Neglect is considered the failure to provide safe and appropriate amount of food, shelter, and medical care. So for the purposes of this presentation, we are specifically looking at physical abuse. So physical abuse is physical injury inflicted upon a child with cruel and or malicious intent. Examples of this can be punching, beating, kicking, biting, burning, shaking, or otherwise physically harming a child. Before we start talking about the relationship between alcohol abuse and physical abuse, I want to take some time to look at alcohol abuse in general in this country. So as you can see on your screen, over 15 million adults in the United States abuse alcohol. I'm sure that's not necessarily a surprising statistic for most of us, as most of us do know people in our lives who do abuse alcohol. According to the National Institute of Alcohol Abuse and Alcoholism, alcohol use disorder is characterized by compulsive alcohol use, loss of control over alcohol intake, and a negative emotional state when using. So I think it's important to note that alcohol use disorder is not just the compulsive alcohol use, but it's also the loss of control over how much alcohol one is consuming, and then also the negative emotional state when the person is not using alcohol. As we begin to talk about the relationship between alcohol abuse and parental physical abuse in children, I want you to think a little bit about what those reasons might be. So I'm going to go through a few statistics and some facts, but I want you to be thinking about sort of why you think that this relationship exists. And then at the end of the slide, kind of compare what your thoughts were compared to what our research found. So as we know, alcoholism is a major element that contributes to child abuse. A study by the National Institute of Mental Health concluded that substance abuse disorders appear to be the most common and among the most powerfully associated with maltreatment, approximately tripling the risk of committing maltreatment when other factors such as social and demographic variables were controlled for. Further studies found one of the most substantial factors of committing physical assault on a child is the parent's use of alcohol. Heavy drinking increases the risk for child maltreatment, especially in child physical abuse. In fact, parents who identify as alcohol abusers are 4.7 times more likely to commit physical abuse against their children, which is the statistic that you see on your screen. So I asked you a few minutes ago to be thinking about some of the reasons that substance abuse and child abuse may be linked. So some of the reasons that we found include that alcohol can directly affect cognitive and physical functioning, as we all know. Reduces self-control, lowers inhibitions, which can allow an individual to act violently towards their children. Alcohol use by parents and caregivers can also impair their sense of responsibility and reduce the amount of time and money that can be spent on a child, which can lead to neglect. So in the United States alone, 35% of offenders of fatal child abuse were under the influence of alcohol at the time. So that means that in 35% of the cases where a child died from abuse, 35% of the time those parents were under the influence of alcohol. So I'm wondering if your answers, when you were thinking about the connection between alcohol use and child maltreatment, I wonder if those were similar to the answers I gave. Or if there were other reasons that you can think of. So feel free to comment below if you had any different reasons why you think that substance abuse could possibly, or specifically alcohol abuse, could be linked to child abuse. So obviously we all know that child abuse and any trauma is not a positive situation. That's a negative situation. So on your screen, you see some statistics about adverse childhood experiences, also known as ACEs. So this is talking about if we could eliminate adverse childhood experiences, we would see work productivity increase by 61%. Suicide and life dissatisfaction could decrease by 67%, and anxiety could be reduced by 56%. The adverse effects of abuse in childhood is well documented, including increased risk of psychiatric disorders such as anxiety and major depression, and increased risk of suicidal thoughts in adulthood. Emotional regulation and self-esteem can be the product of an unhealthy attachment with an adult as a child due to trauma. I personally work in child welfare for the state of Wisconsin, so I work very closely with children who have been abused and neglected, and the major thing that we see is this unhealthy attachment. So a lot of concerns with kids attaching appropriately to caregivers. So that can be from one end of the spectrum to the other. One end being kids that are overly attached to strangers. There is no, that stranger danger that we think of as appropriate. They will just go to anyone, are comfortable with anyone. To the opposite end of the spectrum, where they are unable to attach emotionally with anyone, even a caring foster parent who may have been caring for them for years. So we know that there are this abuse and neglect, specifically physical abuse, does affect children, and therefore we need a solution to try and prevent this. Here you can see some more statistics about the widespread epidemic of child abuse in our country. So in 2011, the U.S. Department of Health and Human Services estimated that 18% of the 667,000 children abused or neglected were physically abused by their parents. So more than 500,000 children have been abused and neglected in 2011, and 18% of those are physical abuse. So as you can see from these statistics on your screen, our current solutions are not working because in many states, child abuse rates are increasing. So I want to take a minute to kind of look at what current solutions are, like what we as a country are doing now to prevent child abuse, so that we can kind of focus on our solution in a little bit. So traditional child abuse prevention focuses on addressing concerns at the micro level, which includes parents and families. So things like home visitation and family support services promote high quality parenting and a nurturing environment to families at risk. Also, current strategies include family support and parenting training, screenings for child maltreatment, services for victims, and community-based educational programs. So while current child abuse prevention services provide vital information and support to children and families, physical abuse of a child continues to be a problem of epidemic proportions. Current education for school site social workers specifically focuses on identifying the symptoms of child abuse, such as unexplained bruises, burns, or welts, or identifying a child who appears frightened of a parent or caregiver. But again, these are all things to look for after abuse has occurred. There's not a whole lot in place for prevention. So as you can see, Arizona child abuse rates are increasing. Specifically, this data is from 2009 to 2012. We found a statement by Chris Swenson Smith, who is the division director at the Children and Family Services Division of Pima County Juvenile Court Services for Family. And Swenson Smith stated that existing programs treat only a handful of issues related to child maltreatment instead of the entire family. And services related to child maltreatment and alcohol abuse do not coincide and therefore leave an opportunity for parental abuse of alcohol to lead to child maltreatment. He also attributed the increase in child abuse to drastic state budgets cut from prevention and support services for families. At the state level, programs like Arizonians for Children allocate resources and provide support to children who are suffering from abuse, neglect, or abandonment. Over 850 children have been served by the nonprofit organization. However, state programs such as this one target children who have already experienced physical abuse and address several risk factors at once, not alcohol abuse specifically. Current screenings of children come after the physical abuse has occurred. So again, this is a program that is doing a lot of good work serving children, but this is not necessarily preventative work. I want to take a moment to just look at this slide and really think about this. All maltreatment deaths are preventable. We have children dying in our country, and they don't need to be. So according to the Arizona Child Fatality Review Program, all of the substance abuse related maltreatment deaths were determined to be preventable. So without a standing process for screening parents for possible alcohol abuse, there's a higher risk factor for physical child abuse to occur and therefore for child deaths to occur. We need to do something different. We believe that school social workers at the elementary school level in Phoenix, Arizona, have an opportunity to implement early screening of parents to assess possible alcohol dependency and the risk for child maltreatment in the home. So, our solution is that routine screenings for parental alcohol abuse be performed at the school. So, our thoughts is that these screenings can be conducted in the form of an annual survey at the beginning of the school year, given to parents as part of the registration process. We understand that legally we may not be able to force parents to complete these surveys, but if we made it mandatory for schools, especially school social workers and other school staff handling registration, to be handing out these screenings and surveys, then we have a greater likelihood of people voluntarily choosing to participate in the screening and the survey. Specifically, the screening would be looking for how much is this parent drinking and how much alcohol dependence does the parent have. We found results from a study conducted by Murphy et al. That showed that early substance abuse screening can expedite whether or not parents are eligible to keep their children. So, social workers at Phoenix elementary schools can use these screenings, similar to the court system, to analyze the risk of physical child abuse. The safety of the child should be a priority, especially for young children in the elementary school system. The process of removing a child from an unsafe environment, which is the responsibility of the courts, can be long and tedious. So it is our opinion that a mandatory screening of all parents who have children in elementary school will not only speed up the process by alerting the social workers earlier, who then can report concerns to the state or the county and the courts earlier. We also feel like it would hold parents accountable for possible risk of alcohol abuse in early treatment and intervention. We believe that intervention for physical child abuse often occurs too late. These interventions are normally instituted after child abuse occurs. We know that parental alcohol abuse is a major predictor of physical child abuse. Therefore, if there was a simple way to screen parents for their alcohol abuse, we may be able to prevent physical child abuse from occurring by providing services to these families preemptively. We know that schools are on the front lines and school social workers are often the first point of access for families to community resources. Therefore, our conclusion is that if elementary school social workers across Phoenix school districts were to start routine screens of parental alcohol abuse, we may actually save lives. Thanks for taking the time to listen to my presentation that I put together in Capstone 2. As you can see, these are our references. If you feel like you need more information, feel free to look at these sources. I'm curious to see if people have other thoughts on how we can work to be more preemptive with preventing abuse and neglect versus coming in after abuse and neglect has occurred. So I'd love to hear your guys' thoughts and to see if there's anything else that we could implement, because we do know that this is such a problem in our society and then it has such a lasting effect on children. And as these children grow up and to be adults, it has a real lasting effect on our society. So there's something that we need to be doing better as a country to be preventing abuse and neglect of children. So any ideas you guys have, I'd love to hear them. Please feel free to post comments below. As I said before, this is the field that I work in. This is something I'm extremely passionate about. So any ideas that you have would be great because I'm in the field, and if there's things that we could be doing better as social workers in the child welfare field, I'd love to hear it. Thanks for your time.